We're going to begin with Omicron because coronavirus infections around the world jumped over the weekend. China reported the highest number of cases since January. Australia reported more than 10,000 daily cases for the first time since the start of this pandemic. And according to CNN, daily Omicron infections in the U.S. have now surpassed those from the Delta variant. And holiday travel is not helping here. There were more than 2,800 flight cancellations in the U.S. over this past Christmas weekend. Why? Of course, an increase in COVID cases. This led to airline crew shortages during one of the busiest travel periods of the year. On Saturday, United, Delta, and JetBlue canceled at least 12% of their flights. And on Christmas Eve here in New York, we reported the highest number of new cases ever. And that came as New York City's museums, concerts, and Broadway theaters desperately tried to keep their doors open. One thing this new variant didn't seem to impact much is shopping, because holiday sales in the U.S. rose 8.5% from last year. That's according to MasterCard. And online shopping, of course, jumped as well, 11%, while department store sales were up 21%. With me now to discuss is Bloomberg's Angelica Peebles. Angelica, welcome to Quicktake, and thanks for being here right after the holiday. We appreciate it. Tell me first what the experts are anticipating in terms of cases and hospitalizations. If we're seeing these spikes already, we don't even have a clear picture of the spread to come from Christmas gatherings, and we're about to be at New Year's. So how bad is this going to get?
Everyone's expecting cases to continue to rise. Unfortunately, like you said, we are in the middle of a holiday season where people are gathering more than possibly at any point during the year. So all the signs are pointing to this spread continuing. However, the good news is that people largely are expecting hospitalizations to stay lower than they have been in previous surges because so many people are vaccinated. Of course, not everyone's vaccinated, and there is a risk that the sheer number of cases could result in higher hospitalizations than we might expect, given this this variant could be more milder. But still, the good news is that we hopefully won't see quite the strain on the system that we've seen before.
Well, I'm also curious if the variant might sort of rip through the U.S. like it did with South Africa and then sort of subside, which is sort of the situation we're seeing again right now in South Africa. Are you hearing any more details about that from the experts you've spoken with, this idea that the variant might kind of have a huge spike and then hopefully disappear?
Exactly. That's what people think could very well happen here. You're seeing it play out in South Africa and other countries already that are in the middle of these huge spikes, starting to see those numbers come down. And while it might not sound like a good thing, that is the hope that if cases do rise, it'll happen quickly and then we can move forward from there. You're seeing, of course, the numbers shooting up in places like New York and Washington, D.C. And the idea is that maybe it'll start to come back down as quickly as it went up.
Well, I also want to talk about what the response to these surges could look like. There seems to be two camps, even among, the health experts that you and I have been interviewing the whole pandemic, with some saying, okay, it's pretty clear that this is just something we're going to have to live with, and others saying, no, we still need to fight back. I want to listen to what Dr. Fauci had to say about that earlier.
The issue that we don't want to get complacent about, John, is that when you have such a high volume of new infections, it might override a real diminution in severity.
So that's exactly what you were saying, Angelica, that even if it's less severe, just the sheer number of people exposed to this is going to lead to an uptick in the severe cases, the hospitalizations, for example. Given that debate that I mentioned between kind of holding our hands up and really fighting back, where do most public health experts stand on what our day-to-day fight against Omicron should look like?
Health experts that I've seen talking about this publicly have said that they in their own lives are starting to take a little bit more caution. Many of them saying, maybe they held back from gathering with their families for the holidays. However, I haven't seen a real push for lockdowns again. The Biden administration itself saying over and over, we're not going back into lockdown. We have vaccines. Now we have pills. So we are in a better position to confront this virus. But I do think, this winter is shaping up to be, there's probably going to be a lot of COVID circulating. And so health experts are definitely saying maybe we should be more cautious than we have been the past few months, especially over the summer when it seemed like this whole thing was over. And now here we are heading into the winter with cases really rising.
Right, right. What data points are you looking into most to kind of give you an indication as to where we're going with this variant? Are you looking at positive cases? Are you looking at hospitalizations, ICU beds?
Hospitalizations is really the metric that health officials are looking at to see really the position that we might find ourselves in terms of the severity of the illness and whether our healthcare system can handle this latest surge. Cases have always been questionable number. People have scrutinized whether they're the best metric, and same with deaths because they lag. And the cases here might skyrocket. However, if those cases are in vaccinated people, the idea is that it might just be a cold for them and not something you have to worry about as much as your healthcare system collapsing because there are so many people sick with COVID.
I know that another thing that we're still learning about is the long-term impact, even for those who didn't have super severe reactions to getting COVID. When do you think that we will know exactly what the impact of Omicron is going to look like? I feel like we keep hearing from experts, one more week. When are we going to know that, okay, this is going to go away, or we need to change course with our public health measures?
I wish I had a great answer for the day that we could say definitively, here is how Omicron looks compared to previous variants. I think we are starting to see more data coming out again, supporting the idea that this variant does produce less severe illness than previous variants. However, health experts are saying we still don't know definitively. We're still looking for that data. I would expect that it continues to trickle out over the coming weeks, but I unfortunately don't have a concrete date when we can say, here is exactly what we know.
I know, fair enough. It's not fair for me to ask you to predict where this pandemic is going to go. That's a pretty tall order. I do want to talk about one piece of good news, which you've mentioned, is treatments. What do people need to know about how they can potentially access treatments if they do test positive? What does the course of action look like for those patients?
It's still being worked out exactly how these pills will get into the hands of patients. However, I think the best advice is to tell people, just if you have a doctor, call your doctor, see if they recommend any of the treatments that are out there today, whether they're monoclonal antibodies or these new pills. That's probably your best bet as the system works out exactly how to dole these treatments out to patients across the U.S.
And one other piece of good news that we learned about from your reporting is that holiday sales were not super impacted by the Omicron variant. I know that you showed that there was an 8.5% jump from last year. The White House Chief of Staff, Ronald Klein, cited these numbers as proof that the vaccination campaign in the U.S. is having a positive impact, not only on the economy, but also in our fight against COVID. Though, of course, as we've been discussing, we are in the middle of a surge. So I'm curious, what did you find in your reporting to be the biggest driver of increased spending? Was it increased vaccinations?
The spending was really up across the board, and the report yesterday did cite that spending was highest in apparel and then jewelry, electronics. So it's hard to pinpoint exactly what caused that.
Yeah.
The people in the report, the experts quoted, did say that people might want to upgrade their wardrobe given they've been hibernating for a long time.
Right.
So it seems that people are really just looking to shop and spend across all categories. Sales were up both in stores and online. So just overall increased sales.
Right. I know for me that the credit card swiping is always kind of a self-soothing technique that I probably need to get a hold of in 2022. Angelica, thank you so much for joining us this morning. That was Angelica Peebles from Bloomberg News.